Hi, my name is Dr. Dillon Remmick here with Healthsource Chiropractic in Baxter, and I have another health tip for you guys this week, as well as just to give you an understanding of why people typically deal with the second most common problem we see in our office, which is neck pain and headaches. First one is low back pain, which I talked about last time. This time we're going to talk about neck pain and headaches. So down here, I have a model of a spine here, and what this looks at is this would be the spine from the side. This is somebody facing this way, so just like connected to my body, just like this. Head sits up here, neck, middle back, lower back, and these are the two pelvic bones here. When we look at the spine, this is what the spine looks like from behind. It should be straight. From the side, we should have some nice curves that run through the spine. Now, you wonder, why does the spine have curves in the first place? Really, the purpose of a curve, it's a shock absorber. So when we carry weight on a curved spine, it's like a spring versus on a straight spine. All that happens is it jams down the weight, right? So to give you guys an idea, I'm going to come over to this board here. When we look at a spine, the first thing we want to see when we look at a spine is kind of a nice banana-shaped curve. The head would be here, the nose would be up here, so the person's facing this direction. When you carry weight on a spine like that, all that's going to happen is it's going to spring. Well, if your neck somehow shifts into a different position and the spine goes straight, all that weight just pushes down these discs. What the spine shows is that when the weight is carried like this versus this, typically it's going to wear out anywhere between 8 to 10 times faster than a normal spine. So to give you an idea of what that actually looks like is if you look at this chart over here, this spine here is a normal spine. You'll see there's a nice curve in the spine. You'll see there's nice spaces. Those are the black spaces are the discs. As the spine straightens, which can happen from repetitive movement, injury, accidents, weight pushes on the discs more, and eventually the discs start to wear. So you'll see the spaces are getting smaller, and if it sits like this for long enough, we'll start to see really severe arthritis that shows up, which at that point sometimes can be surgical. So what do we do to help with problems like this? I'll tell you, when we work with a patient, typically when they come in, we sit down and go through a very thorough evaluation, different consultation, orthopedic tests, neurologic tests, physical tests. We also go through functional muscle testing. That's where we sit down and test different muscles that surround the spine to figure out which ones are strong, but also which ones are weak that could contribute to some of the problems. And then based on that, for many patients, we do take x-rays because if we can see it, we can understand it more. Most commonly, we'll notice as we look at a spine is that when somebody's dealing with headache problems, remember this is the base of the skull, this is the top nerve in the spine, many times this nerve gets pinched. When this nerve gets pinched, it leads to the headaches that people think are normal. Headaches aren't normal, they're common for a lot of people, but they can be helped a lot just by taking pressure off that nerve. So if you're wondering, hey, do I have a problem that chiropractic can help with neck pain or headaches? I'll tell you, I don't know yet. But the best way to find out is to come in and sit down and see if we can help. So my first suggestion is if you're curious to see if chiropractic is the right solution for your problem, give us a call or respond to this post or share it with somebody you think that could use some help, and we'll see what we can do to help.